All right, so welcome back in. The day of conversation is continuing here. I hope you all enjoyed our last conversation with Dr. Rebecca Lester. That was amazing to talk about reclaiming recovery. In this next segment, we're going to dive into that intersection between eating disorders and substance use. This was something that impacted me personally in my own recovery. And I know in talking with a lot of people here in the ANID community, that a lot of individuals do deal with that co-occurring eating disorder and substance use disorder. So without further ado, I'm going to pull up the video here as we pre-recorded an amazing conversation with Pat Aussem from Partnership to End Addiction. I hope you all take as much away from this conversation as I did. Everyone, I am Jason Wood. It is great to continue the day of conversation here at ANID. I am really excited to welcome Pat from the Partnership to End Addiction and to talk about the intersection of substance use and eating disorders. So Pat, welcome. Would you like to go ahead and introduce yourself today?
Hi, Jason. Thanks. So Pat Aussem, I am the Vice President of Consumer Clinical Content Development at Partnership to End Addiction. So the organization is a nonprofit that provides support across the nation for families who have loved ones struggling with substance use and mental health disorders. So my role is really to help families figure out what is my next step and what kind of information do I need that's actionable? How do I find treatment that is quality treatment? How do I pay for treatment? How do I support a loved one? How do I even have a conversation that doesn't implode, right? Because often it can be really difficult to have those conversations.
Yeah, those are the same conversations we navigate here at Anna too with loved ones. I think you brought up a really good point with the families. Like substance use impacts the entire family, eating disorders impact the entire family. So it's one of those things that we got to be able to support everyone,
Right,
not just the
right.
individual who might be struggling. So I'm curious, in your work, where do you see the overlap? Where have you seen the intersections between substance use and eating disorders?
Well, first, I think generally speaking, many people think that they are, totally separate issues, but they often live in the same emotional space. So in my work, for instance, I've seen someone, who will come to see me because I also have a small private practice. Talk to someone who is coming to see me for substance use issues. So say it's alcohol. And then in the course of the conversation, they talk about binging or restricting food or something like that. Um, and so, they may look different on the outside. One involves food and the other substances, but underneath they often serve the same purpose. So, and those, it varies obviously from one person to another, but it can be, anxiety, trauma, dealing with control issues. But I think underlying all of it is like escaping this emotional pain. And both of them work on the same part of the brain, the reward system of the brain. So what starts out as a behavior, whether that's in binging or drinking or doing stimulants, whatever, what starts out as a way to get relief ends up becoming a pattern that becomes very difficult to break. So regardless of whether it's food or substances, I think, there, like I said, there's a huge amount of overlap. And they need to be screened together. Often we don't do screening, which I'm sure we'll talk about a little bit later, but um, it really can be a big issue in terms of understanding the full picture of what someone is dealing with.
Yeah. Yeah, one of the questions I'm excited to get to, and I think we'll get to it in a little bit. If we don't, we'll make sure to save some time at the end of the conversation for it. Is that I know I've talked to a lot of people who it seems like they can only get treated for one or the other. They will go into a facility and they will only focus on the one. You've got to be sober in order to enter eating disorder treatment, or the other way around.
Right.
And that can be really difficult because from my personal experience and from those of the people that I've talked to, you need to tackle both because oftentimes those factors, those underlying factors are the same between both conditions.
Yeah,
So
absolutely.
yeah, I guess what are some of the common risk factors that you do see?
So I think the, from uh, there's several shared risk factors, I should say. So certainly trauma is a big one. and adverse childhood experiences, which could be emotional or physical neglect, abuse of some kind, even bullying or living in a really chaotic or invalidating environment can be problematic. Certainly difficulty with regulating your emotions. So the emotions feel too big and it's like, how do I, what can I do to tamp that down so that I don't feel, as distressed as I might otherwise. Perfectionism is a big one, certainly, and high achievement pressure. Impulsivity, right? So often, certainly on the substance use side, we see that as a huge risk factor. And likewise, in bulimia or binge purge cycles, there can be some impulsivity. Body image dissatisfaction, right? Alcohol and stimulants are sometimes used to suppress appetite or reduce social anxiety. And then often there's a neurobiological risk factor, meaning that, somebody's genetically predisposed to struggle with a substance use and or eating disorder issue.
Mhm. One of the questions that came to mind as you were sharing that is the whole kind of need for perfection, because that is something that personally it related to me, but also where you talk about individuals maybe trying to numb emotions or gain control over situations, and then kind of falling into a cycle there. Where they can't break out of it. It becomes that routine, that habit that is very difficult to get out of. And so I'm curious from your experience, have you seen that kind of same thing emerge where it's either trying to numb something or gain control over situations that might feel completely out of someone's control?
Yeah, often it can be both. I think people often will try to numb out and then they'll look for control, and then it becomes a repeating cycle that can shift over time. So,
Mhm.
from a substance use perspective, it's frequently about numbing. I don't want to feel this way. Eating disorders, especially restriction, can often start out as control. And then over time, it changes. So, the restriction can become compulsive and numbing, and the substance use can feel controlling. Like if I smoke cigarettes, I
Mhm.
can control my weight, as an example. Or if
Mhm.
I use cocaine, I can control my weight. So I think it becomes this loop, this emotional distress loop that goes back and forth between numbing out and control.
Yeah, yeah. I was thinking back about my own personal experience, and I can relate to a lot of that. I had lost both of my parents young in life, and I went through a lot of grief and pain with that. And that is kind of when the substance use started because I wanted to numb things out. But then over time, it was like I felt like a failure. It felt like life was spiraling out of control. So I was trying to gain control as much as I could. And then that's when I
Right,
turned to the diet and to the exercise and things like that.
right,
So it was constantly grasping for either trying to numb something
right.
or to gain control over the situation.
I often talk to families about what substances do for people. And my question to them is, what if I could give you something that's going to help you reduce your stress, reduce your anxiety, help you with your sleep, help you with boredom, help you, gain weight, lose weight, have better sex, whatever. Would you take it? And people are like, well, yeah, sure.
Mhm.
And substances do that, and they do that very effectively in a very short period of time.
Mhm.
And then over time, as you know, it can get out of hand and there can be a lot of severe consequences.
Yeah. Yeah. One of the things I say a lot, and especially when I'm talking to the eating disorder community, is that it's serving a purpose. It
Absolutely.
is absolutely serving a purpose. And that is why recovery can be so difficult. Because first you've got to be able to break away from that and realize, like, let go of almost like a security blanket. I
Right.
sometimes refer to it as like Linus from Charlie Brown with his little blue blanket. Like you gotta let that go, but it can be really, really difficult those early days in recovery to do that.
Right. Right.
Um, what are some red flags that family members could be on the lookout for, and even providers should be mindful of when meeting with patients?
So from the family standpoint, I think it's, clearly red flags are around the behaviors associated with eating. So skipping meals, right? Constantly saying that you can only eat certain foods or, restricting, etc. I actually have a person right now that I'm working with who weighs herself probably 10, 15, 20 times a day.
Mm,
And She had been pregnant. She's had the baby, a successful pregnancy. She drinks to calm her anxiety, but her body image and her, like I said, this obsessive behaviors around weighing herself are something that both that she struggles with. A lot of exercise, excessive exercise, right?
Mhm.
To try to burn those calories off or what have you. Certainly, people that are using substances often hide it. So you might find that, they're drinking alone, or you might find paraphernalia in the home somewhere or in the car. Um, you often will start to see changes in just mood completely, so they might be more depressed, more anxious, often related to their substance use. Insomnia can be a big issue. Then there are emotional red flags. So a lot of irritability, as an example, or increased anxiety, mood swings, right? So sometimes it's hard to ascertain, is this just like, they're cranky because of something that happened, or is this something that's more sustained? Withdrawing socially, obsessive talk about weight, calories, or being able to earn, I'm using air quotes, earn food,
Mhm.
right?
Mhm.
Um, and in college kids, often we'll see that the kid's not eating all day and then drinking heavily at night, or using alcohol instead of meals, or sometimes using stimulants during exams to suppress appetite, but also to use stimulants to be able to focus more. Supposedly, it doesn't really work if you look at the research, but you find people are taking study drugs, as they are often referred to. Um, so those can all be warning signs to look for, red flags to look for.
Yeah, yeah. Thanks for sharing those. Yeah, one of the things I was just talking to a student group last night at a university, and I really wanted to raise the warning signs around what we kind of call drunkorexia. It's not a formalized diagnosis or anything, but where we do see a lot of teenagers who are saving those calories all for alcohol and then leading to binge drinking and just really harmful behaviors.
Oh, absolutely. I had worked with a couple of young women who were in college. And first of all, they start off with pre-gaming, right? So we're
Mhm.
going to drink before we go out so we don't have to spend as much money. And we're not going to eat anything. And because, too many calories in the food. And then, sometimes you even find that they're purging after drinking. So high risk for rapid intoxication, which can lead to alcohol poisoning, blackouts for sure. So, blackouts are where people just don't recall what happened, even though it looks like you and I talking right now, but they don't remember what happened. And then you become more vulnerable to sexual assaults or other concerning behavior, risky behaviors. And long term, a lot of metabolic and liver damage can occur.
Yeah. Yeah, it definitely can. So I'm glad that we're having this conversation. So hopefully we can get those red flags out there and that awareness out there because these are the conversations we need to have. But I think sometimes they're so stigmatized or even stereotyped where it's like, oh, that can't happen to me. That can't happen to our family. And the truth is it can happen to anybody, unfortunately.
Absolutely.
I'm curious when it comes to like screening gaps in a medical setting and from providers, what kind of gaps are there right now when it comes to screening eating disorders and substance use and maybe what can we do to resolve some of those?
Well, you started off in a comment you made earlier about siloed treatment and the fact that often people are screened for one or the other, but only treated for one or the other. And so that ends up being a problem. Um, and there's also stigma. Sometimes substance use can feel worse to admit. But for other people, maybe it's their eating disorder and how they feel about their body image and so forth. So that can be, especially for males, right, where it could go under recognized, I think. Um, so, routine dual screening in primary care, schools, and college health, I think would really be helpful for both.
Mm.
In addition to other mental health problems. So I think we're getting better at looking at depression and anxiety, but we need to broaden the perspective a little bit there. Trauma-informed assessments for sure. And then training providers to recognize less stereotypical presentations. I actually saw in an article on the American Psychiatric Foundation's website last week a new screening tool. I'm not sure if you come across it, though it's WebMD, but it's with two B's. Did you see
Mhm.
that?
No, I didn't see that. Oh, I will
Very
have to
cool.
check that out.
So the W in WebMD is to look at weight and um, not only the absolute number, but what are the changes in the weight pattern over time. Exercise is the E in terms of what's the amount and the type of exercise that someone's engaging in and for what purpose. Is it just to be healthy? Is it to run a marathon or is it,
Yeah.
to try to get rid of calories? The first B is body image. So what are your thoughts and behaviors around your body image? The second one was behaviors to really get at the heart of are you restricting in some way or binging or so forth. M is Menzies for whether you're having a regular period or not. And the D stands for your diet history and what that looks like. So they were recommending it as a new way to evaluate people for eating disorders.
That is
So
amazing. I'm
people might
taking
want
notes
to check
over
that out.
here.
It's pretty straightforward. So I
Excellent.
think that can help. I think, you know, obviously integrated treatment is what we need. Whenever someone walks in, it's like if you walked in and you were having a heart attack and a broken arm, we wouldn't just treat the heart attack, right? We would
Yeah.
look at the broken arm too. And so regardless of what a person's concerns are, I think it's really important to look at their overall well-being, including, the way they are processing things, so the behaviors and so forth, as well as their environment and what they're going back to, because sometimes the environment can be very triggering for people, and we need to make sure that discharge plans from treatment are really holistic and actionable, right? You can afford the medication, or you can get to the counseling program, you can pay for the counseling, that sort of thing.
Yeah, absolutely. One of the things I was thinking about too is as we're thinking about treatment and recovery and kind of what that looks like and breaking away from that maybe siloed approach, is it common or do you see it happen regularly where an individual might swap one condition for the other as they're going through that healing process and working through the recovery journey?
Yeah, so interesting. I was thinking about that question a while ago because I used to work in a psychiatric hospital. We had a ton of people that would come in who had bariatric or lap band surgery,
Mhm.
and then they were coming to us because they had an alcohol use disorder. So they basically had swapped the eating that they had been doing and the calories that they were gaining that way for alcohol because they could drink. And, I think part of the problem is that, the underlying pain was never treated, and the brain is now searching for a different coping tool. So that's why people swap from one to the other. So any kind of recovery has to really address, what was that purpose? What purpose was it serving in the first place, whether it's for the eating disorder and or the substance use disorder?
Yeah. Yeah, and using that word recovery, I don't know if you do it over at your organization, but here we've found that recovery has many different definitions, and the healing journey looks different for everybody. So I'm curious, what would recovery or healing look like for somebody that's got the two co-occurring conditions with substance use and eating disorders?
So it's so interesting, Jason, because I think for a long time we were marching down the path of very black and white. It's either you aren't using at all, or you're using, but you're either totally in recovery and you're doing this perfectly, or you're not. And I think that the biggest thing that we've learned over the last decade or so is that recovery is not perfection.
Mhm.
So it looks like fewer crises, more emotional awareness, healthier coping skills, and really learning how to be without using food or substances to deal with life and what life throws at you. It may be improved relationships, like you can talk to your family about this, and that your family understands and they're supportive as opposed to being critical. Um, Certainly from an eating disorder perspective, it would be more flexibility around food. Um, sobriety may be part of the picture, maybe not. Maybe it means that you are going to cut way back on what you've been doing or um, reducing the harm associated with what you've been doing. And then I think really being compassionate towards yourself as opposed to feeling shameful or guilty about what you're doing. It's like, it's okay. This is, and I think more than anything, it's really to hammer home, this is a health issue. Both of them are health issues. It isn't because you didn't have enough willpower. So that part of it, I think, is really important. And it's not a straight line. People have setbacks all the time. And I always look at a setback as a learning opportunity. Like, okay, let's examine what happened here. What could we do differently next time? So this is a way you learn.
Mhm.
I when I talk to the people that I care about in terms of their recovery, I often talk about, like if you make a, a commitment at New Year's, a resolution of some kind, that
Mhm.
you're going to go to the gym, 5 days a week, and that's what you're going to do because you want to be healthy and go to the gym, right? Uh, Often people are really gung-ho in the beginning, right? For the first 2 or 3 weeks, it looks pretty. And then you get to that day where it's rainy outside, you didn't sleep well last night, you know, um, you have a big work project to do, and you just can't or won't or don't get to the gym. Does it mean you failed? No, it means there was one day that you didn't make it to the gym. And I think it's the same thing with recovery from any mental health issue. It's giving yourself that grace that you can have a setback and then just, learn from it and keep moving in a healthy direction.
Yeah, that is the biggest message I try to share in our peer support groups that we have here at ANID, is finding that self-compassion. And for me, I've always been a very competitive person. So my therapist and my treatment team worked with me to kind of look at recovery almost like a competition and being like, hey, it's okay if the eating disorder scores a point here and there. You can always come back and score the next go around. And it
Oh,
was
I
like
love
just kind
that.
of having that reminder
Yeah.
was very helpful for me, and knowing that I don't have to be perfect. This doesn't have to be a shutout. There are going to be days
Right.
where, unfortunately, the eating disorder wins, but I can always come back and fight again.
I like
So
that a lot. I'm going to have to steal that, Jason.
yeah, go for it. Go for it. It was helpful for me. So I guess the last question that I have for you in regards to this conversation is around families. So what can families do? I circling back to what we were talking about at the beginning, substance use, eating disorders, they impact the entire household, the entire family. How can families be there for a loved one as they're navigating this really challenging road, this up and down journey of treatment and recovery?
Yeah, so important. I know that the research shows that when families are involved and supportive, the outcomes are so much better on both disorders. So I think that one of the most important things is to not be the food police or the substance use police or whatever. You want to have a relationship with your loved one. So that means really focusing on the connection over the control. So I care about you versus what did you eat or did you drink last night? Um, I think being curious and asking questions like, you seem overwhelmed lately. What's going on? Really trying to keep that door open for conversations. In our um, nonprofit, we use CRAFT, which is called Community Reinforcement and Family Training. And the skills are all about having conversations. Like, how do you have an effective conversation with a loved one so that it doesn't implode? So that if you want to encourage treatment, you can encourage treatment. So that if you want to have a conversation about it, you don't get the, leave me alone and the eyes rolling or what have you. And then there are also behavior management suggestions, techniques, if you will, to try and encourage the behaviors you want to see more of and putting some boundaries in place for the ones that you don't want to see. So, and I also think that parents need to get their, and other family members for that matter, or caregivers, probably need their own support. And
Mhm.
I think it's really helpful, because it can be emotionally exhausting Um, I think having family therapy can also be very helpful so that, you can have a conversation with a loved one about how can I best support you. Um, and the love, and likewise, the family can talk it to the loved one about, we just want to know how you're doing and we don't know how to ask that question. We don't know how to check in with you. Or if we see you doing something or starting to go down a pathway that's leading you away from health, what can we do or how can we approach intervening so that it doesn't feel like we're policing you, but that we're asking you questions or, you know, saying that we think you should do something else only because it's coming from a place of love and care.
Yeah. Yeah, absolutely. As family members and loved ones, you don't have to have all the answers. Sometimes asking the questions is the best way that you can support someone, and it makes them feel empowered too. Like
Right.
they're part of this because they are. That was all my questions. One of the things that I did want to ask you to share though, really quick, is tell us a little bit about Partnership to End Addiction and the work that you're doing there, and some of the resources that might be available for folks who are listening today.
Oh, thanks for that question, Jason. I love the partnership. I've been there for over 10 years, and I think it's an amazing organization, and everybody I know that's there is so passionate about the work. The name is, right, Partnership to End Addiction. So the idea is, it's the moonshot. We can end addiction as a country if we focus on how do we really raise healthy, resilient kids, because we know that when someone starts using substances before the age of 18, they've got a 1 in 4 chance of developing a substance use disorder. Whereas if they wait, so the message is delay, 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 then it drops to a 1 in 25 chance. We offer a helpline in English and Spanish. So the folks that are trained helpline specialists are phenomenal people who will listen to you and what your concerns are, and they will help you develop a plan if that's what you want to do. They will point you to really good resources if that's what you need. But I think for many families, it's the first time they might have shared kind of what's going on, behind the picket fence, if you will,
Mhm.
and feel that they're not being judged. We also have peer support groups as well as peer parent coaches to help families understand, like, you're not the only one going through this. There are other people that have walked in your shoes and they might have suggestions or thoughts about ways that you could interact with your loved one. We have some digital supports, including a text-based messaging program to offer text messages that are delivered to your phone. And some of the messages are inspirational and hopeful, and others are going to link you to resources that can be helpful. Um, and we have a ton of information on our website about everything from, different substances, different parenting skills, which, by the way, we have free parenting skill courses. All of our services are free, I should say, free and confidential. But lots of information so that families can figure out, what do I do next to help my loved one, whether it's preventing substance use to begin with, whether you've just found a vape pen in your kid's backpack and you don't know what to do, whether your daughter is using IV heroin and she's pregnant and you're trying to figure out, what do I do to support her? So we help families with their kids. And when I say kids, it's kids of any age. We've been working with people who have 40-year-old kids, right? To help them. But it's a fabulous collection of resources embodied by people who are just so passionate, because almost everybody has some kind of lived experience or knows someone that got them into this field and whatnot. So I certainly appreciate you asking that question.
Absolutely. I appreciate all the work you're doing. And for folks that are watching today or receiving the recording, we'll make sure to have a link to your website on there. We'll have the helpline on there so that people can get in touch with you if they need additional support. So much, Pam, for joining us today and for being a part of the day of conversation, for all the incredible work you're doing. And I look forward to keeping the collaboration going between our two organizations.
Sounds great, Jason. Look forward to